We had some follow-up questions on the procedure for doing the ozone. So first question was, is ozone safe? And actually it's very safe. The recommended dose is too much can burn the skin, but the standard dose is ozone is probably the safest thing that I can do in medicine. It just doesn't have side effects and just lots of benefits. Secondly, does it hurt? It actually does not hurt typically. When I do it in the skin with the low concentration, doesn't burn. If I'm doing in a soft tissue area though that needs anti-inflammation, I need to use a higher dose, and that can burn for 1 to 2 minutes and then it goes away. When I do the facelift procedure, it's a very low dose of ozone. There's pressure with it, but not pain, and that goes away. I'll talk a little bit more about that in a moment. All the prolozone in the joints tolerate the gas going in very well without any pain at all. You'll feel a little pressure. That gas gets absorbed over 24 hours and is well tolerated. So it really is not painful as such. Some have asked, does ozone do other things than what I'd already mentioned? And there's a lot of things that ozone does. Ozone is germicidal. It kills all of the different infections, yeast, viruses, bacteria. It enhances mitochondrial function. It boosts the immune system, the natural killer cells, the T-cell lymphocytes. There's a whole bunch of things I wrote down here. It actually lowers cholesterol, lowers the bad cholesterol. It actually raises 30 different cytokines in the blood, all these anti-inflammatory factors. So very good at that. One study in Cuba, they actually lowered the creatinine level from 3.5 to 1.5 in chronic renal failure. That was very dramatic to me. It also decreases the platelet aggregation, which is what happens when we take aspirin or baby aspirin to decrease heart attacks. So ozone does the same thing, and it's a more natural way of doing that. It actually lowers blood pressure, helps balance metabolism. Another study was done on treatment of alcohol withdrawal syndrome by giving ozone, helped the patient get through that much better. There was also a really interesting study studying vestibular cochlear syndrome, which is dizziness, ringing in the ears, decreased hearing, that vertigo. By doing a certain protocol, many patients were helped by doing that. That's injecting ozone gas into the neck muscles, and you need quite a few of those, but that's been very helpful. And then, of course, I did mention we can treat scars, cellulite, stretch marks, along with even decreasing fat tissue. So many things that ozone can do. It's probably one of the neatest molecules that I've learned about in medicine, and very excited to do these kind of things. Another useful thing is patients that are about to have surgery or even get chemotherapy, by doing a series of 7 pre-treatments, 2 a week till you get 7 done, patients have been found to tolerate these procedures much better, breeze through them, get out of recovery quicker, and tolerate chemotherapy much better. So very exciting on all of that. The other thing I'm real excited about is this facelift procedure, where patients need 3 treatments 1 month apart, and on each side of the face I inject 18 different spots, and it's deep to the bone to raise the fascia up off the bone and separate the different layers of the skin to stimulate incredible collagen growth, because we stop making collagen at age 30. So this is a very exciting new procedure that I've learned about. Another thing that can be done is that we can make ozone water that you can drink and get ozone internally. Very exciting. And there's also a lot of ozonated oils, olive oil, coconut oil, different ones. Now that's a much harder procedure to do. It has to be done commercially, but these are available. So when you get this ozonated oil, you can rub it on the skin to treat acne, burns, open ulcerated areas, herpes lesions, this kind of thing. So the ozonated oils are going to be very interesting and useful too, along with drinking the ozone water. So if you have any questions on any of these things, please call our office, and we're glad to tell you more. That's all. Thank you.